Hi, everyone. Well, we promised you more on the internet, so here it is. I'm Katie Couric here with Dr. John LaPook, and we're talking about vitamin D because a big study came out today about vitamin D and breast cancer. And before we get to that, John, let's talk about vitamin D in general because it seems like it's the latest wonder vitamin. We've been hearing so much about it in recent months.
Right.
Why is it important?
Well, when I was in medical school, it was important because if you had low vitamin D, it led to brittle bones. And now in recent years, we're finding all sorts of other things.
Other things like what? The benefits of vitamin D?
Yeah, you know, we started studying how vitamin D works, and it turns out that it's important for cell growth, and then somebody found out that it was important for cancer cells to blow up, apoptosis, your favorite word.
Cell death.
Cell death. And then they looked to see whether low vitamin D led to various cancers, and sure enough, it turns out that people who have low levels of vitamin D have a higher chance of getting breast cancer and colon cancer and maybe even some other cancers. So the big question is, you know, is that just a chance relationship or is that actually a cause and effect?
Is that a new study? Because I remember reading something about the sort of the correlation between colon cancer, my area of interest, and lack of milk consumption.
Over the last
didn't the study come out about that?
Over the last couple of years, you've seen what's called epidemiological observational studies, where people say, over the long run, over a number of years, if you look at people who develop colon cancer or they develop breast cancer, they have a higher chance of having a low level of vitamin D. But then it's not sure whether it's cause and effect. But it's very interesting because it's been known with breast cancer, for example, that women who, the closer you live to the equator, where you get more sunlight and a higher chance of having a high level of, and a good level of vitamin D, the closer you are to the equator, the lower chance you have of getting breast cancer. As you move away from the equator, and presumably your exposure to sunlight goes down and your vitamin D level goes down, you have a higher chance of getting breast cancer.
Isn't that true of some other diseases like multiple sclerosis?
Multiple sclerosis, you know, yes, people have talked about that possible association. And in fact, now that everybody and their mother's coming in asking for vitamin D levels, people are trying to associate low vitamin D with everything. And in fact, people have wondered whether it's associated with multiple sclerosis, fibromyalgia, all sorts of depression. So of course,
because well, that seems to make sense because when you talk about those light boxes and seasonal affective disorder,
and so is it the light or is it the vitamin D? And that's a perfect example.
Doesn't sunlight have vitamin D? Doesn't it help you produce it?
Yes, absolutely. So
Doctor?
It's tricky. Yes. So it's, you know, people say sunlight, you know, helps you produce vitamin. Does it beam the vitamin D into your body? No. What happens is you have a chemical in your skin. And when the sunlight goes onto it, it causes that to turn into an active form of vitamin D. So if you have sunlight exposure, then you can get vitamin D. And right now, we're avoiding the sun for good reasons, you know, in terms of not going into tanning salons, and trying to be, you know, get sunburns. But what happens is we spend more of our time indoors. We live in a part of the world where there may be not enough sunlight during, say, the winter months. And because of that, our vitamin D level goes down.
All right, so the big question I think everybody has now, and hopefully people looking at this want to know, is what is the best way to make sure you have adequate levels of vitamin D in your body?
Okay, so the first thing is sunlight. You can go out, say, and the recommendation, I was looking on the web today and I spoke to a few experts, so nobody knows exactly, right? But 5 to 30 minutes, 2 to 3 times a week from, say, 10 to 3.
I told my dermatologist this, and she went ballistic.
But it's not a matter of you know, frying yourself in the sun. And in any case, people who have darker skin, right, like African Americans, have the equivalent of an SPF 8,000. So even if they're out in the sun, they may not get enough level activation of their vitamin D. And in fact, that's true. African Americans tend to have lower level of vitamin D. So what do? You can get it in your diet with fish like salmon, mackerel, tuna. It is in milk.
And then you can get mercury to boot.
Yeah, I know. That we did that other piece saying, as I was reading that, I said, oh, but in the other piece we said everything in moderation, including excess, right? I mean, you can get it in milk, okay, but there's not all that much fortified. There's 400 international units in a quart of milk, and who's drinking a quart of milk these days, especially as an adult? And you know what's interesting I found out today, I did not know this, is that they put in the vitamin D at the very end of the process. So when they make cheese, cottage cheese, yogurt, they're taking out the milk before they add in the vitamin D. So you're not getting extra vitamin D from having those products, like cheese. I didn't know that until today.
I did not know that
I did not know that.
Okay, so
and then
you
the
can
last
get it
way
from
is
food.
supplements.
And what about getting it from supplements? Isn't that sort of the surefire way, and you don't necessarily put yourself at risk for getting sort of
skin cancer? Sure. Melanoma in a Swedish study has been associated with with being in the tanning salons, and we know that squamous cells, basal cells. The American Academy of Dermatology went ballistic, thinking about anybody recommending going to a tanning salon to try to get your vitamin D level.
But we should mention that, by the way, they're trying to market tanning salons now, certain tanning salons, as good places to go to get vitamin D, which is really irresponsible, isn't it, as a doctor?
Yeah, even if you were to say, something, if I controlled it and I had a certain type of wavelength and I did it for a certain number of minutes, it would work and it would be... Why do that? It's not a regulated industry. So who knows? Would you send your daughter or son into some tanning salon where you're not sure exactly what they're getting? It's much easier to, number one, get a vitamin D level, know what you're starting out with, which I think is a reasonable thing to do, especially in older people. And number two, there are supplements. Now, here's the caveat. The RDAs, the recommended daily allowance of these things, it's kind of a moving target a little bit. It's 400 international units or maybe 600 as you get older. You can take it from supplements, but think about it. When you take a multivite, there's 400 international units of vitamin D in that. You take some calcium, there's 200, 400, even 600 international units in that.
And don't you have to have vitamin D in conjunction with calcium to make the calcium absorb in your bones?
Very good, and it has positive effects in the kidney too. You need to get it absorbed from the gastrointestinal tract, and you need to have the vitamin D there. And you need magnesium too, so that's why people say to take magnesium. But
with their calcium supplements.
With their calcium supplements. But one of the, Shani Silverberg, who's a world expert today, I spoke to today about calcium metabolism, and she said, what's happening is people are coming in, they're getting a little bit of vitamin D from here, a little bit from there, and then on top of that, you can go on the net and you can just order vitamin D. It's not really regulated. So they're coming in with vitamin D toxicity.
Yikes.
And what's the problem with that is that you can get too much calcium in your urine, and that can lead to kidney stones, and you can have other problems.
Okay, my head is spinning, but I think we got the points across. All right, Dr. John LaPook, thank you very much, and hopefully we were helpful to you guys too. We hope you have a great weekend, and we'll see you later.